Today, we will learn a very basic outline about orbit anatomy. The orbit is a four-sided pyramidal cavity present in the skull that contains and protects the eyeball along with its associated structures. When we say it is a four-sided pyramid, we mean that the base of the pyramid is directed anteriorly and the apex is directed posteriorly toward the brain. The axis of the orbit is directed backward, upward, and medially, approximately 22.5 degrees from the sagittal plane. The volume of the orbit is approximately 30 milliliters. Out of this, the eyeball occupies about 7 milliliters. Let us discuss the dimensions of the orbit. The height of the orbit is approximately 35 millimeters. The width of the orbit is approximately 40 millimeters. The depth of the orbit is approximately 45 to 50 millimeters. These are formed by 7 bones. These bones contribute to 4 walls: the floor, medial wall, lateral wall, and roof. The orbital floor is formed mainly by the maxilla, which is the major contributor. It is also formed by the zygomatic bone and a small contribution from the palatine bone. The orbital floor is clinically important because it is the most commonly fractured wall in blowout fractures. Next, let us discuss the medial wall, which is the thinnest wall of the orbit. The medial wall is formed mainly by the ethmoid bone, specifically the lamina papyrachia. It is also formed by the lacrimal bone, maxilla, and sphenoid bone. Because it is very thin, infections from the ethmoid sinus can easily spread into the orbit. Now, coming to the lateral wall, which is the strongest wall of the orbit. The lateral wall is formed by the zygomatic bone and the greater wing of the sphenoid bone. This wall is thick and strong, and it is the safest surgical approach to access the orbit. Finally, let us discuss the orbital roof. The orbital roof is formed mainly by the frontal bone, which is the major contributor. It also has a contribution from the lesser wing of the sphenoid bone. The orbital roof separates the orbit from the anterior cranial fossa. So, to summarize, the orbit is a four-sided pyramidal cavity with its base anterior and apex posterior. It has a volume of approximately 30 milliliters and dimensions of 35 millimeters in height, 40 millimeters in width, and 45 to 50 millimeters in depth. It is formed by 7 bones that contribute to 4 walls: the floor, medial wall, lateral wall, and roof. Understanding orbital anatomy is essential for diagnosing orbital trauma, infections, tumors, and performing orbital surgeries. Thank you.